Hello friends, I am Dr. Sandeep Bhasin. Today I'll be discussing with you about FUE hair transplantation and why FUE hair transplantation is considered the best technology in hair transplantation. You know, there are two techniques, FUT or the strip method, and FUE, which is like where we do the extraction of the grafts. So what are the differences in the two methods? When we do FUT, what we find is follicular unit transplantation, and what we find in FUT technology is that we have to cut a strip about 2 cm or 2.5 cm, and then when we cut the stitch surgically, then we have to stitch it. So there is a linear scar that is always present, but in FUE there is no such linear scar. We know there are small scars of the punches like 0.7, 0.8, but they are hardly visible, whereas the linear scar of the FUT is always visible and everybody can see that scar. So that scar is a very big issue that is there with FUT and which is not present in FUE, and that is one major reason why FUE is becoming more popular. The second thing is, when you take a scar and you cut and stitch, there is a time during which the stitch is going to heal, the wound is going to heal, and during that time when the wound healing is happening, it is going to be painful for the client. So FUT invariably is much more painful post-operatively than compared to FUE. The post-operative pain is more in FUT. Discomfort level is much higher in FUT than FUE. So that is second reason of the post-operative pain that people prefer to go for FUE, because FUE is comparatively is pain-free, painless as compared to FUT. That's another reason why people prefer to go for FUE now as compared to FUT. Now the third thing is the number of grafts maximum that can be get by FUT is about 2000 to 2500. And I remember 5 years back we were doing FUT only, and then at that time we had only 2000 grafts or 2500 grafts to do the hair transplantation, and we used to spread those hair only in the front or back or whatever area was there. We used to consider 2500 the maximum number of grafts we can have. We had no other choice besides that. But with the coming of FUE and FUE becoming more popular, more easy and better, and with time, we are able to take 4000 grafts, 5000 grafts in one sitting, and which is a very big number. And with 4000 grafts, obviously we are able to give much more density to the hair as compared to what we used to give with FUT. So with the advent of FUE, we are getting more number of grafts now. 4000 is an average. We can go up to 5000 also if donor area is good from the back in one sitting. And if we take this number of grafts, then we have a liberty to use this number of grafts to design the hairline, to give greater density of hairline. So I remember when I was using FUT, I had only 2500 grafts. We used to fill big areas with those 2500 grafts, and the density was obviously not very high. In FUE, comparatively, when we have 4000, 5000 grafts, we are giving very dense packing to our clients. That is one very major thing. The density of hair packing is much more in FUE. Another thing is, what I have made a change now is that when I am doing the front, I always do the temporal triangles. So when we do temporal triangle in a client, we see the results are aesthetically much better as compared to when we were not doing temporal triangles in FUT, because number of grafts were less. So we were not focusing on temporal triangles, but now we can do temporal triangles, and that gives us much better looks aesthetically. So hair density is better, aesthetics is better. We are able to create temporal triangle. We are able to create a very good hairline because the number of grafts are much more in FUE as compared to FUT. So that's another big difference. That number of grafts is a big difference between the two technologies. Then with time now we are seeing that the body hair transplantation has become a very big thing. With FUE, you can take hair from the beard, you can take hair from the chest, from the pubic hair, but in FUT, if donor is only from the back of the head, from the occipital hair, we cannot take from face, we cannot take from beard, we cannot take from the pubic area. So they are all very limited choices. FUT, you only can take from the back of the head. Your donor area is very much restricted, but with FUE, your donor area becomes very wide, very big. So that is where FUE is becoming very popular. Now another thing is with FUT, mostly you get double or triple follicles per graft, but in FUE you get double, triple, and you get single follicles because you are able to reach the nape of the neck. And the single follicle hair grafts would be very useful for the front to create the hairline and also in the crown area. So certain areas where we want to use single hair follicles, there FUE is much better than compared to FUT, where we can get the single hair follicles. available for us. So that's another thing that can be there. Then with the FUE, if we see that in subsequent sittings also we are able, if you've done about 3,000, 4,000 graft in one sitting, second sitting we can again get 2,000, 2,500 or 3,000 graft in the second sitting, and we can combine up to beard and we get another 1,500 graft. So you see with FUT we can go up to 8,000 or 10,000 graft in total number, whereas in compared to FUT, even if you take 2 sittings of FUT, you cannot go more than 5,000 grafts. That is the maximum number of grafts that you can get. But in FUE, first sitting you do 4,000, second sitting you do 2,500 from the back and 1,500 from the beard. So total you see you are easily crossing 8,000, 9,000 graft in FUE. So that is the number of grafts is much higher. Now another thing is FUE technology. If you see, we are able to take few grafts. So FUE technology can be used for other things, like we can use FUE technology for doing melanocyte transplantation, because we take few grafts and then those grafts, FUE can be used to take melanin pigment to do melanocyte transplantation beyond hair transplantation. Similarly, for areas like eyebrow transplant and other things where we do less number of grafts, we don't have to give an incision and scar of FUT, where FUE would be the only treatment of choice or the technique of choice. So for eyebrow transplantation, small scar, for concealing small scars, for vitiligo surgeries like melanocyte transplantation, FUE is the technique of choice, because there we don't want to do FUT, we want very limited small number of grafts only. So FUE works much better there as compared to FUT. So for these reasons, I can say that FUE technology is much better and is the versatile technique now and becoming more and more popular. So it is overshadowing and overpowering the FUT technique. Thank you friends, I am Dr. Sandeep Bhasin from Carewell Medical Center.